You don't remember hitting your arms or legs on anything. So why the heaviness and unusual swelling? Could it be lymphedema? Let us be your guide to discover the ins and outs of this condition, exploring both the causes and the actionable ways to manage the swelling that disrupts so many lives. Some global statistics. Did you know that up to 250 million people globally are battling lymphedema? This condition, stemming from both inherited factors and secondary causes, such as cancer treatments, infections, and injuries, impacts more Americans, around 10 million, than those suffering from HIV, Parkinson's, multiple sclerosis, muscular dystrophy, and ALS combined. Particularly among U.S. breast cancer survivors, a staggering 30% experience lymphedema due to the effects of their cancer therapy. In Europe, the occurrence rates hover between 1.33 and 1.44 per 1,000 persons, while in tropical regions, a significant 16.7 million are affected by lymphatic filariasis, a parasitic infection leading to lymphedema. Despite these alarming figures, awareness remains critically low. Many, including cancer survivors who are at high risk, lack crucial information on the importance of early detection and proactive management of lymphedema, often resulting in delayed treatment and a diminished quality of life. But first, what is actually this lymphedema condition that has grown so rampant? Lymphedema explained. Lymphedema, a chronic condition, emerges due to the abnormal buildup of lymphatic fluid within the tissues, predominantly affecting the limbs. This network, comprising lymph nodes and vessels, plays a pivotal role in transporting lymph fluid across the body. This fluid is rich in white blood cells and waste products, crucial for our immune system and waste removal processes. When the lymphatic system faces damage or malfunctions, it leads to the uncomfortable and often distressing accumulation of lymph fluid. There are two primary types of lymphedema to be aware of: primary and secondary. Primary lymphedema, though rare, is typically a congenital condition linked to genetic abnormalities within the lymphatic system. It can present itself at various life stages: at birth, known as Milroy's disease, during puberty as Meige disease, or later in adulthood as lymphedema tarda, each tied to hereditary predispositions. On the other hand, secondary lymphedema is more prevalent and usually stems from external damage to the lymphatic system. Common causes include surgeries, particularly cancer-related ones where lymph nodes are removed or injured, radiation therapy, infections, or physical trauma. It's frequently associated with cancer treatments, notably in breast cancer surgeries. Living with lymphedema can significantly hamper your quality of life. The physical discomfort and pain, coupled with reduced mobility, can turn daily tasks into daunting challenges. While the emotional toll from changes in body image and chronic discomfort can be substantial, yet managing lymphedema effectively can greatly alleviate these symptoms and enhance overall well-being. If lymphedema remains untreated, the stakes are high as it can escalate to severe complications. Recurrent skin infections like cellulitis, lymphangitis, an infection of the lymph vessels, and even lymphangiosarcoma, a rare cancer of the soft tissue, may develop. Moreover, chronic swelling can induce fibrosis, a hardening and thickening of the skin, which further impedes limb functionality and heightens infection risks. Lymphedema is a global issue, impacting millions with a higher incidence in regions battling filariasis, a parasitic infection that leads to secondary lymphedema. In more developed locales, lymphedema is primarily linked to cancer treatments. Estimates suggest that about 1 in 1,000 people in the United States live with lymphedema, with the secondary form being more common. This condition does not discriminate by age and can affect anyone. However, specific groups are more at risk. For primary lymphedema, females, particularly around puberty or later in life, are more susceptible. Secondary lymphedema predominantly affects cancer survivors, especially those who have experienced lymph node removal or radiation treatments. Other risk factors include older age, obesity, and autoimmune conditions such as rheumatoid or psoriatic arthritis, which can exacerbate the symptoms. When it comes to pinpointing this elusive condition, diagnosing lymphedema is a dance of meticulous examination and advanced imaging. Doctors begin with a simple comparison, measuring the circumference of the affected limb against its healthier counterpart. The journey continues through the realms of ultrasound, MRI, and CT scans, with each tool providing a clearer image of the underlying disruptions in the lymphatic system. Techniques like lymphoscintigraphy delve even deeper, offering a detailed map of lymph flow and blockages, while non-invasive methods such as bioimpedance spectroscopy and pyrometry quantify fluid content and limb volume, ensuring a firm diagnosis. Non-surgical treatment. Understanding lymphedema's triggers and mechanisms is crucial, not just for catching it early, but for managing it effectively to stave off further complications and enhance overall life quality. Now let's delve into the world of pain and swelling management for lymphedema, focusing primarily on non-surgical interventions. Among the first lines of defense is compression therapy. Whether it's sleeves, stockings, or wraps, these garments are champions in exerting the right amount of pressure to encourage lymph movement and reduce swelling. Custom-fitted garments are particularly effective, marrying comfort with optimal pressure to ensure both relief and functionality. The success of compression therapy is well documented, showing reductions in limb volume by 30 to 40%. However, the key to unlocking these benefits lies in adherence. Regular use is essential. Then there's Manual Lymphatic Drainage, or MLD, a technique where trained therapists use gentle, rhythmic strokes to coax lymph from congested areas to regions where the lymphatic system is fully functional. When paired with compression therapy, MLD can halve limb volume, offering patients significant relief from pain and immobility. For lasting effects, regular sessions are recommended, typically weekly or bi-weekly. Not to be overlooked, exercise is a cornerstone of lymphedema management. Activities that promote gentle, controlled movements like walking, swimming, or specific strength exercises are particularly beneficial. These activities not only prevent fluid accumulation, but also promote the efficient circulation of lymph throughout the body. Surgical treatment. Turning to more advanced interventions, we delve into the benefits of surgical options such as lymphaticovenous anastomosis, or LVA, and vascularized lymph node transfer, or VLNT. LVA, a microsurgical technique, connects lymphatic vessels to nearby veins to facilitate the flow of lymph fluid around blocked areas. Typically an outpatient procedure, LVA involves minimal incisions and has a success rate of 60 to 80%, offering many patients significant symptom relief. However, it's important to consider potential risks like infection and scarring. VLNT, on the other hand, involves transplanting healthy lymph nodes to the affected area, aiming to restore normal lymphatic drainage. This procedure has shown promising results with success rates between 70 to 90%, and is usually followed by a brief hospital stay. Patients often experience lasting reductions in swelling and a noticeable improvement in limb function, though there are risks of complications at the donor site. Other therapies. Beyond surgeries, managing lymphedema involves various medications and therapies. Pain is typically managed with analgesics such as acetaminophen and NSAIDs, which help alleviate discomfort and enhance quality of life. Additionally, anti-inflammatory treatments like corticosteroids and topical creams are used to reduce limb swelling, often in combination with other strategies for optimal effectiveness. Emerging therapies are also on the horizon, with clinical trials exploring innovative options like low-level laser therapy and stem cell treatments. These new therapies hold the promise of further improving lymphatic function and expanding the possibilities for managing lymphedema effectively. Lifestyle and diet changes. Now let's turn our attention to the role you can play in managing your lymphedema, focusing on lifestyle modifications and self-care strategies that can make a significant difference. Skincare and hygiene are paramount, especially given the increased susceptibility to infections like cellulitis in those with lymphedema. Macmillan Cancer Support emphasizes the importance of maintaining pristine skin hygiene to reduce the risk of infections and other complications. Daily routines should include washing the affected areas with warm water and a mild fragrance-free soap to avoid irritation. It's crucial to gently pat the skin dry, paying extra attention to skin folds where moisture can build up, potentially leading to fungal infections. Regularly moisturizing with hypoallergenic lotions will help keep the skin from drying and cracking, while also steering clear of extreme temperatures that could exacerbate swelling. Diet and nutrition also play a critical role in controlling lymphedema. Adopting an anti-inflammatory diet helps reduce bodily inflammation, incorporating antioxidant-rich fruits and vegetables, along with lean proteins such as fish and poultry. It's advisable to limit processed foods, sugars, and high-sodium items to fend off water retention and prevent lymphedema symptoms from worsening. Hydration is another key aspect of managing lymphedema. Drinking adequate water throughout the day aids in maintaining fluid balance and minimizing fluid retention. Small, frequent sips can help keep dehydration at bay, which is crucial since dehydration can trigger further fluid retention and amplify lymphedema symptoms. Specialized support. Also, the psychological aspect of living with lymphedema cannot be overlooked. The journey can be as mentally challenging as it is physical. Engaging in regular physical activity, staying informed about your condition, and maintaining a routine are vital coping strategies. Psychological support also plays a crucial role in enhancing life quality for those affected. Engaging with support groups and seeking counseling can offer both emotional and practical support, alleviating feelings of isolation and anxiety. Many healthcare settings provide specialized support resources for individuals dealing with lymphedema, ensuring that no one has to face this challenge alone. Regular interactions with healthcare providers are crucial. These routine checkups are key in monitoring your condition, spotting early signs of complications, and fine-tuning your treatment plan. Such diligent medical supervision can halt the progression of lymphedema, significantly enhancing your life quality. Research shows that consistent medical monitoring drastically cuts down the risk of severe complications, bolstering patient outcomes. Self-monitoring is an empowering tool in the daily management of lymphedema. Regularly measuring the circumference of affected limbs and noting changes in size, shape, or other symptoms is recommended. Employing tools like flexible tape measures or bioimpedance devices can yield precise measurements. Maintaining a daily log of these metrics helps in early identification of potential issues, allowing for prompt intervention. Prevention and prompt recognition of complications are crucial. Early signs of complications such as cellulitis and the rare but serious lymphangiosarcoma should be recognized swiftly. Signs of cellulitis include redness, warmth, and swelling of the affected area, often accompanied by fever. Lymphangiosarcoma might present as purplish patches or nodules on the skin. Immediate action can prevent these conditions from escalating. If complications arise, swift action is essential. For cellulitis, initiating an antibiotic regimen promptly as prescribed by your healthcare provider is vital. Elevating the affected limb and avoiding compression garments during active infections are also beneficial. For any unusual skin changes, seeking medical advice without delay is crucial to rule out conditions like lymphangiosarcoma. Educating patients on self-management techniques is fundamental in maintaining control over lymphedema. Instruction in proper skincare routines, the application of compression garments, and manual lymphatic drainage techniques empower patients, boosting adherence to treatment and enhancing outcomes. Resources for ongoing education and support are plentiful. Organizations like the National Lymphedema Network, along with various healthcare providers, offer comprehensive educational materials, support groups, and counseling services. These resources keep patients abreast of the latest in management strategies and provide much-needed emotional support, reducing the loneliness often associated with chronic conditions. Today, we have explored the intricacies of lymphedema, covering its causes, symptoms, and a range of effective management techniques. From medical treatments to lifestyle changes and innovative therapies, there are numerous ways to alleviate pain and reduce swelling. Controlling lymphedema is achievable through understanding and proactive measures. Begin your path to relief and improved well-being now, because taking the first step towards managing lymphedema starts today.